Hi everyone, once again welcome to my YouTube channel PsychWatch, which explains about psychiatric nursing topic and psychology topics. Today we are discussing about one interesting topic which is actually in continuation with my previous video which was on mental retardation. Mental retardation, autism, attention deficit hyperactivity disorder, learning disorders, all these childhood psychiatric problems are termed as a pervasive developmental disorder or neurological developmental disorder. Autism is one of the important childhood psychiatric disorder, which is very important because the number of people associated with this illness is increasing day by day. There are so many reasons that we will discuss after a while. Before starting this presentation on autism, let me share one interesting story that really happened in one of my friend's house. Actually, my friend has two sisters and they were really enjoying their life like anything. That particular day, which was New Year Eve, 31st December, they were planning to have fun with their friends. And these sisters offered, or they ready to sponsor snacks for that particular event on 31st December. Just before leaving for that party, they realized that they couldn't buy that snack. So they rushed, they took their car. When they reached the mall, fortunately they could get a parking space which is very close to the entrance. Then they enter into the mall and they realize that there are a lot of rush in that mall. In spite of that rush, they enter into the mall, but they couldn't find these snacks which they were supposed to buy for that event. Somehow they could select some other snack, and when one of the sisters was paying the bill, there was a loud noise. Everyone astonished to see that the other sister was showing some abnormal behavior. She was crawling on the floor and she was doing certain physical activity that she herself is making some sort of injurious activity, that she was biting herself and rocking her head on the floor. With the help of few of the security persons of the mall, the other sister take this sister who was doing all this abnormal behavior to home, and after 3 hours she could manage her symptom, and once the symptoms get subsided, the new year was over. What was really happened in that situation? One person was normal and another person was autistic. When they planned for this New Year party and they realized that that particular snack was missing in their home, it was abnormal, or it was a strange experience for the person who is with this autism. When they reached the mall, they could get a parking space which is very close to the entrance. Usually they are parking their car very far away from the entrance. It was an abnormal, or it is a different from that of routine experience what she had. When they entered into the mall, there was a lot of rush. The sensory stimuli was disturbing for the person who is affected with the autism. Then when they searched for the snack, they couldn't see the snack. That was also away from routine. That is, it is not the routine thing what they are experiencing. And after these abnormal experience, abnormal sensory stimuli because of the loud noises, etc., her behavior could went on abnormal, as she herself done certain activities which was injurious for her. This is exactly happening in autism. So autism is a complex neurological disorder which may limit everyday functioning, because if a person is affected with autism, it can affect their day-to-day functions, and mostly it will end up with certain disabilities in that individual who is affected with autism. Mostly it affects the social relationship, it affects the communication, it affects behavior. That is behavior, social interaction and communication. BSC, behavior, socialization and communication. Usually it starts in early life. Once it started, it may go throughout the life. So it's a developmental disorder, starts in the early life, runs throughout the lifespan. Then what is a neurodevelopmental disorder? As you know, most of the psychiatric disorders nowadays can be termed as a neurodevelopmental disorder. Of course, autism is a major neurodevelopmental disorder. There are certain characteristics which says that autism is a neurodevelopmental disorder. First one is, it's a syndrome. Mostly the person affected with autism may have various problems, not a single problem. I told you it is the problems related to behavior, it is the problem related to socialization, it is the problem related to communication. Then mostly it starts in early period, that is pediatric onset, then affect brain function. Definitely there is a brain pathology in neurodevelopmental disorder, as in case of this autism. And clinical effects on affects cognition and behavior. Now we see what are the etiological factors of autism. Autism spectrum disorder actually, because a lot of disorders comes under this common heading, that is autism spectrum disorder. That is the terminology that is used in DSM-5. For this autism spectrum disorder, etiological factors are genetic factors. It runs in family. Childhood autism is more commonly seen in males. Then age of parent is an etiological factor. As the age advances in the parents, there is more chance for getting their child autism-like behavior or autism-like disorder. Environmental factors are also involving. So etiological factors are genetic, gender, parental age and environment. Now, before going detail regarding this autism, one must know how autism is explained. Medical condition. Why it is a medical condition? Because there is exact brain pathology. Definitely we can consider this as a disorder, not as a disability or disease. In autism, child is showing brain function which is somewhat different from that of a normal person. So that word normal is very difficult to explain. And in social model, it is somewhat disability. Disability in the environment where the person lives. As in case of initial story, this environmental stimuli, the sounds, the smell, the lights, the stimuli which a person gets normally may be interpreted differently in case of autism. The sensitivity towards this input may be different in case of a child who is affected with autism. So environment causing disability, that is the sociological concept behind that model. And say different neurological wiring, neurological function. It is not abnormal, it's a different one. That is what. It's a different way of thinking when considering a child with autism and a normal child. Now, regarding the epidemiology of autism, 1 in 68 normal child are affected with autism. 14 out of thousands in 2 to 9 years of age are affected with autism in India. See, 14 out of 1000 normal children. It is the third highest childhood neurological disorder after mental retardation and cerebral palsy. So it's a major problem, and it is 5 times more commonly seen in males. 60% of autistic people are unemployed. Mostly they are underemployed, even though they are qualified, because of the symptoms what they experience. They will not get proper placements. That is important. 87% of these children with autism can have some sort of mental illness, comorbid psychiatric conditions. It can be anxiety, it can be obsessive compulsive disorder, it can be depression. So 87% of individuals affected with autism may get some sort of mental illness in later life. 9 times more likely to commit suicide with normal. The possibility of committing suicide by a person who is affected with this autism is 9 times higher compared to a normal person. Average life expectancy of a person affected with autism is 54 years. That is an important one. I already told you autism is a spectrum, Autism Spectrum Disorder, ASD. What is that spectrum means? So, when a person is affected with autism, their problem can be explained on a continuum. Low functions to high function, low IQ to high IQ, low activity to hyperactivity, low emotions to extreme emotions, low anxiety to extreme anxiety, low depressions to extreme depression, low skills to extreme or perfect high skills, low sensation to high sensation, especially touch, pain and texture. And sleep problem can be there. Activities of daily living can be there. All these things can shown in a continuum. So that means a person who is right now at this point in the continuum can move as the age advances. So it can be positive or negative. I already told you, in autism, the child affected with this autism have problem with the behavior, socialization and communication, BSC. So we'll see what are the behavioral problem that we can see in a person who is affected with, who is diagnosed with autism. Repetitive behavior. That is usually the commonest symptom that parents notice during initial period. Repetitive behavior. They will be involved in certain odd behavior and they will continue in that behavior even though the rest of the stimuli are there. Even the parents ask for something, call something, they will not, actually they are hearing, but they are too involved in this behavior, this activity, so that parents may think that they do have hearing problem. That is one thing. Mostly that individual is focusing on parts. When compared with a normal person, for example, a normal person can see a forest, whereas a person who is with this autism may see in this forest one specific tree, one branch, even one leaf. They may focus on that leaf when the other normal person who see a forest. That means the person is too much involved in specific aspect of reality. That is what is focus on parts. is a behavior. Then preoccupation. I told you, when the child plays with a certain things, certain odd things, and focusing on that one, too much involved in that one, and they may think, or the parents may think that the person is hearingly impaired or hearing impairment is there in that child, and mostly the person is preoccupied in that activity which is seemingly not important for a normal person. The need for sameness and routine. As in case of that initial story, what happened when that girl entered into that particular mall for buying snacks? So routines were disturbed. Actually, they were getting that parking lot in a different area, but because of the change in that routine, it affected. When they enter into the mall, a lot of noise were there. The routine was affected. When they searching for that snacks, that routine was affected. So whenever a person is affected, a person is with this autism, they want this sameness or routine. So that is one of the behavior that we can see in case of this autism. Then rocking and flapping. Usually the person may have certain flapping type of activity behavior, a rocking, head rocking. That type of behavior you can see when the person is affected with autism. Hypersensitivity or lack of awareness. Hypersensitivity towards the stimuli, towards the sensation, pain, then all those things, sound, voice, light. So all these sensation, they may have hypersensitivity. That is the behavior that we can see. So regarding autism affects behavior. Second one is socialization. The person will not be able to maintain that social relationship. Rapport will not be able to establish with that individual. Usually, individuals affected with this autism are too much involved in self-centered activity. They will not see, they will not interact with others, and they will not be able to maintain eye contacts. Poor eye contact is a characteristic feature of a person who is with this autism. Then difficulty in reading facial expressions of others. Usually children know, they can read what is the facial expression of their parents or others. Whereas in case of this autism, the child will not be able to read the facial expression. And interestingly, the persons affected with this autism, they will not show that facial expression which others can also read. That is also there. No shared enjoyment. Usually the child who is affected with autism may show that solitary play. That is what, no shared enjoyment. They will not involve with other children and will play, that associative play will not be there in case of this autism. Mostly they may show some body posture which shows that they are not interested. So that is affecting socialization. Then regarding communication, both verbal and non-verbal communications are affected in case of autism. There is always possibility of delay in talk or not talk. Usually this can be the initial symptom which can help us to diagnose autism. So that is the first thing. Mostly stereotyped communications you can see. Echolalia can be seen. So they may just to mimic what others are speaking or the examiner is speaking. Echolalia. Then mostly they are concerned with the concreteness. What exactly they see, the word meaning it is important for them. What they speak, that is important. They will not consider the emotional content of that talk. Then mostly they may focus on self. They are not interested with others. So that is regarding communication. So autism affects behavior, socialization and communication. So regarding diagnosis, mostly diagnosis is, autism is based on DSM-5 criteria. Two important things are there. That is, first one is persistent deficit in social communication and interaction. Second one is restrictive, repetitive behavior and interests. So based on the type of communication, social communication, what the child makes will help you to diagnose autism. Second one is restrictive or repetitive behavior that we can observe in a person who is affected with autism. In persistent deficit in social communications, you can see problem with social reciprocity. When a person is communicating to us, we may show some reciprocity with that individual. We may communicate to that individual based on what the person is talking to us. Definitely the emotional content of that talk which we receive is influencing what we are responding. In case of this autism, that is absent. That is first thing. There will not be any relationship with the peers. I already told you, children affected with autism mostly are self-centered. They will not establish any relationship with the peers. And mostly there won't be any non-verbal communication. So that is the first criteria for diagnosing autism. Second one is repetitive, restrictive behavior and interests. Mostly the individual will have a fixed interest, fixed awkward type of interest. They may be involved in that activity. He is only interested in that activity. Repetitive stereotyped behavior, you can see. Mostly the individual who is affected with autism may have fixed routine. If something happens and if something results in change in this routine, they won't be able to appreciate that change. So they will stick on to routines. Then increased or decreased reactivity to stimuli. That also I explained. Then regarding treatments. Treatment of childhood autism is mainly pharmacotherapy. Pharmacotherapy is mainly used to control symptoms associated with this one. If the person is agitated, if the person is aggressive, if the person is showing some mutilating behavior, self-injuring behavior. So in order to control that particular symptoms, first we can use certain psychopharmacological agents like antidepressants, anti-anxiety drugs. Even mild antipsychotics can be prescribed for such individual. Then behavioral therapy, positive reinforcement for even establishing eye contact. We can give this positive reinforcement. So mostly an individual affected with this autism may have problem with this socialization. If the child shows some sort of signs that he is establishing that social relationship, we need to appreciate, we need to give positive reinforcement. If we give this positive reinforcement, very well we can inculcate certain type of positive behavior in that child. And special schooling, but it is not that much accepted. If the person is not showing aggressive behavior or if the self-mutilating behavior is not there, we can have integrated schooling. We can send them to normal schools where normal children learns. They may be slow learners, but in case of this high performing autism or Asperger's syndrome, they are brilliant. Their IQ level is very high. So definitely we can keep these children with autism in normal schools. And the counseling. Mostly parents needs counseling. Parental education is also very important. So this is regarding the treatment. Regarding nursing management, we need to work with the child on one-to-one basis. The initial base, we need to stick on with this one-to-one basis. That means one nurse, one child, one teacher, one child. We can focus only on one child, and step by step we can teach them the socialization, we can teach the positive behavior, we can teach them communication. So there are excellent models in India as well as abroad where this one-to-one type of interaction with the child with autism can improve their communication, their behavior, their socialization. So these are the main problem mainly seen in children with autism. Then protect the child from self-mutilation. Mostly the rocking behavior, agitated behavior, self-mutilating behavior, all this can injure the child himself. So while caring a person who is affected with autism, a nurse must remember to protect the child from self-mutilation. Try to be consistent because anticipate the need. Mostly the child affected with autism may not be able to communicate their need. So such situation we can anticipate their need. Clarification and validation of needs are expressed. Many a time child will not be disclosing their needs verbally. So from their behavior, we need to identify their needs. Once you identify the need, you need to clarify their need. You need to validate the need to assure that, to make sure that what we perceive is the real need of the child or not. Then promote self-care. Once we establish a healthy, positive, professional relationship with the client, we need to make sure that child's self-care activities are gradually, or the child is able to do the self-care activities. You need to teach the self-care activities. Then language training is another important thing while considering the nursing management of a child with autism. Then coming to Asperger's syndrome, it is otherwise known as high function autism, where the person may have non-verbal learning disabilities, but the IQ is very high. Symptoms are social interaction problem, language problem, and others. Social interaction problem can be limited or inappropriate, poor eye contact, poor friendship, poor communication, not able to identify emotional cues. As in case of this autism, that social interaction problems are same. Apart from that, the child can have language problem, increased verbal communication. That is specifically seen in case of this autism, increased verbal communication. The child may talk a lot without hearing what the other person is talking to them. They will go on speaking. Then one-sided conversation. They will keep on speaking something. So that one-sided communications you can see in case of this Asperger's syndrome. Then mostly they are using sophisticated languages. That is very important. Their vocabulary may be high, or good vocabulary they can have. So that you can see. Then see pieces. Focus on parts, not the whole. They do have high memory. They can remember a lot of things. They very well can pick up patterns. Their mathematic ability is very high. So these are some of the symptoms that you can see in case of Asperger's syndrome. Mostly children affected with this one can have disruptive behavior like screaming and tantrums, aggression, mostly hitting, biting, pinching, then self-injury, head banging, self-punching, slamming on desk that you can see, then self-stimulation, that is rocking, masturbating, and self-spinning. All these can be seen in case of this challenging behavior in case of Asperger's disorder. Mostly child affected with Asperger's disorder can give occupational therapy. Apart from what we discussed in this autism spectrum disorder, childhood autism, we can give this occupational therapy, integrated schooling, and sensory integration. So these are some additional management technique that we can use in case of this Asperger's disorder. Then regarding nursing management, one must remember nursing management with 9 C's. That is, change the perspective. Change the perspective that autism is an not abnormal, but different ways of behavior. Not abnormal behavior, it's a different ways of behavior. That is, change the perspective. If you are a nurse, change your perspective. Remember, autism is a different type of behavior, not an abnormal behavior. Different way of thinking, not an abnormal thinking. Different ways of emotion, not an abnormal emotion. They are different, not abnormal. Be consistent. Second C is consistent. Because change in routine, change in sameness may result in abnormal stimulation, and that can result in abnormal behavior. So try to be consistent. Third C is communicate your expectations. Always communicate what you are expecting, because the person may have problem with the communication. They will not be able to read your face. They will not be able to read your non-verbal cues. So communicate your expectation. Clinicians, not clinicians. That means that is the next C. Consistent with the clinician. Don't go for doctor shopping, because it's a developmental disorder. It will be there with the child throughout the life. Mostly what we can see is the person who is affected, parents who is with the child who is with this autism can go for doctor shopping. So clinician, not clinicians. Then come with the family member. Always support the child. Family members can play a major role in the management of child with this autism. Provide calm environment, because sensory integration is very important. Sensory overload, sensory sensitivity or stimuli from the environment can precipitate abnormal behavior. Provide a caring environment. Always give choice. Never stick on to yes or no type of situations. Choice, give them choice. Then counteract stigma, because social stigma is a major problem while dealing with a person's problem related to autism. So social stigma need to be addressed. So with regard to nursing management, one must remember 9 C's. Change the perspective. Consistency. Communicate your expectations. Clinician, not clinicians. Come with a family member. Provide calm environment. Give caring environment, supportive environment. Give choices, not yes or no type. Counteract stigma. So these are the 9 C's. Many a time you need to restrain the client who is showing this abnormal behavior. In order to prevent the self-injurious activity, you may have to restrain the client. For restraining, you can have pharmacological restraining or physical restraining. In pharmacological restraining, usually drug of choice is benzodiazepine. Sometimes ketamines are also effective for controlling their aggressive behavior, or using ketamines for restraining purpose. Physical restraining can be blankets. Never tie the extremities with ropes. Blankets are the choice for physical restraining. Then regarding Rett syndrome. So Rett syndrome comes under this Autism Spectrum Disorder, which is specifically or occur only in girls. That is Rett syndrome. If you have any more doubts, you can comment.